Dr. Hani Abirossen. He's from Beirut and he's based between Beirut and London. He has been since actually 10 years. He is a KOL for many laboratories and pharmaceutical companies around the world. One of them is Cosmosoft and Bioceutical Switzerland and the ASRS Belgium. He has been providing also trainings in advanced aesthetic procedures, including thread lifting. For many years, he has been in UK and he works mainly on Harvey Street Clinic. Dr. Hani also, he was the winner of the prestigious Best European Medical Practice Award in 2018. And actually today, our Dr. Hani will talk about BodySculptor device and the biosimilarity technology behind it. And one of the main topics also is gonna be the link between the coronavirus disease and many cases now in the UK and US hospitals. Thank you for being here with us, and over to Dr. Hani.
Hi, everyone. So I'm Dr. Hani Abirossen, broadcasting today from my office, where I'm alone, of course. It's 1 p.m. now in the UK, 4 p.m. UK time. I hope you are all keeping safe during these hard times, but also that you were able to do some good stuff as well and useful stuff during your quarantine. So trying to make most out of this isolation is one of the reasons we decided, in collaboration with Cosmosoft France, to share and prepare this webinar for you, where I'll be sharing my long experience with a great technology that helped me assist lots of people during their weight loss journey. A unique technology that have had enough time until today to prove its efficacy and safety among many other body contouring technology. So why the BodySculptor? Why the biostimology? And where is the superiority in relying on such a technology and the machine to promise not only aesthetic results, but also a healthier patient profile along with the life quality improvement? First of all, I'm gonna start with the fat science, why all fats are not the same, and what are the most dangerous and health-threatening fat layers. As you can see here in the picture, we do have the subcutaneous fat that takes place under the dermis. We do also have the retroperitoneal fat that is also located in the rear abdominal area. And we do have the visceral fat, which are the fat amounts located in between the viscera, which are mainly our main vital organs. And of course, as you must all know, the visceral fat is our main concern because this is where health and immunity can be compromised when these fat layers become big and can lead to some organs compression, and also can lead to other health complications like cardiovascular risk increase, and also can lead to what we call the metabolic syndrome. So the metabolic syndrome, unfortunately, is associated with many other pathologies like hypertension, problematic lipid profile, PCOS, heart disease, insulin resistance, some cancers, and also type 2 diabetes. So this is where actually the BodySculptor technology shows its additional benefits when it comes to targeting deep fat layers. So this is why when I'm recruiting my BodySculptor patients, I also try always to convince them that the importance is also to treat the visceral fat, because it's also about their health and not only about their beauty. Visceral fat do have can lead to many complications, as you can see here in the picture, like pulmonary disease and so on, phlebitis, cancer, bladder disease, etc. Now, what about obesity and coronavirus? There was a very important and interesting report that was published by The Telegraph in the UK. And it was based on an audit revealed by the NHS, where they say that almost 2/3 of critically ill coronavirus patients were overweight, and of which 37% are actually under 60. So obese and overweight coronavirus were the most in need of critical care. If we see here another report by the ICNARC on COVID-19, and which was released now in April 2020, where they show us actually that the total, for a total number of 2,049 patients, we can see on the right that 1,559 patients were in critical care. And taking a look here at the latest table here on the right, we can see that 70% of the patients that were admitted in intensive care unit in the UK with coronavirus were actually those who were obese or overweight. So this is why we can now conclude that obesity can be actually risk increasing for coronavirus infections. And this is why after this publication in the UK, severely obese people have been advised to leave work and self-isolate since they are at high risk of severe coronavirus. So why obesity is a risk factor? We are going to see many impacts of obesity on many vital functions. Let's have a look now between a lean and an obese patient when it comes to the lungs. If we do a quick comparison, we could see actually that the resting lung volume in obese patient is reduced because we do have a compression of the lungs due to surrounding adipose tissue and reduction in the lung compliance. Another impact is also on the immune response. If we take a look on the immune responses between lean and obese patients, we can see on the right that obese patients tend to have an excessive immune response. Let's have a look at the T cells, the B cells, the natural killers, and the macrophage, where we see that they do have a quick response when a lean and obese patients are exposed to the same infection. So that's why we do have an increase in the risk of autoimmunity and an impaired protective immunity when it comes to lots of visceral fat in obese patients. Also, obese patients are well known to be having breathing issues. Obesity can actually interfere with respiratory functions by decreasing lung volume. It is now set and proven that lung function is highly associated with lots of abdominal fat rather than the sub-Q fat. Reduction in weight improves clinical outcomes and enhances lung function. And also obesity is associated with a low-grade inflammation of white adipose tissue, resulting from chronic activation of the innate immune system, and therefore risk of autoimmune disease can be increased as well. So why the BodySculptor technology? Why do we rely on this technology mainly when it comes to treating obesity and visceral fat? This is where it shows actually additional benefits when it comes to treating deep fatty layers. If you take a look at the BodySculptor along with other devices for body contouring, we can see in the arrows that the BodySculptor targets not only the subcutaneous fat, but also the visceral fat, which are the deep fat layers around the viscera and the organs. Whereas all the other technologies for lipolysis or for fat reduction mainly target the sub-Q fat and do have only aesthetic purposes. If you have a quick look at the technology that is behind this machine, it's actually based on a very low frequency bioenergetic field. And if we have a look at the arrow here, where we can see the home power lines, the radio, the TV, etc., going all the way to the X-rays, we can actually see that it's a non-invasive, non-aggressive, totally painless treatment based on a 50 Hertz frequency, which is extremely low and therefore extremely safe. The mechanism of action is based on the muscular stimulation. We're gonna see right away how does this work without any destructive cellular process. So the mode of action, the BodySculptor induces 5 to 10% increase in the adipose activities at the sarcoplasmic reticulum of smooth muscle. And this is actually how it leads to non-sensible continuous muscle contractions and relaxations. This is how it actually works. Magnetic field opens the calcium channels and stimulate the release of calcium ions from the sarcoplasmic reticulum to induce muscle contraction. The muscle contraction itself induces an energy consumption. Each contraction hydrolyzes up to 10 ATP molecules per second, and this is where we've got the energy loss, the energy consumption, and therefore the fat burning effect. As a summary, we can see that the bioenergetic field leads to activating the calcium pump. Therefore, we do have a stimulation of the muscle contraction, the smooth fiber muscles, and striated as well, leading to lipolysis. And as we can see at the bottom, the exchange of the calcium ions can lead to consecutive contracting and relaxation of the muscles. And on the right, we can see an average of the results we do have after a full treatment, which is of 12 sessions, 45 minutes each. We do have an inch loss of 7 centimeters on the waistline, visceral fat reduction around 8%, 4% of sub-Q fat, reduction of abdominal fat and associated health risks. And also we do have an improvement in all the liver enzyme in terms of AZAT and ALAT. Why is it called the 3-in-1 slimming technology? Actually, the BodySculptor leads to great result when it comes to reduction of the subcutaneous fat, and also it gives an improved skin firmness. And we're going to see how this dual action works when we overview the apparatus itself. When it comes to reduction of the visceral fat, this is how we were able to actually measure the reduction of the visceral fat. A study that worked by Dr. Carpentier and Dr. Nuira using a scanner imaging study, where we did have 20 volunteers, of which 12 were females and 8 were males, with an average weight of 95 kilograms and an average BMI of 3.9, which is almost obese. An average of 6 centimeters in waist circumference and 8.2% in visceral body fat. And this is how the images can show actually the reduction in the fat around the viscera. This is one patient, a male in Japan. This is a before and after. The after picture was taken after 12 sessions, and we can see the reduction in volume and in centimeters. This is how we were able to measure the volume loss, which is around 3,312 milliliter, and the waistline reduction was of 9 centimeters. Also keep in mind that the volume reduction is not only fat, it is definitely also fluid and water loss, because the drainage that the BodySculptor does can actually remove excessive water. And this is why we do have a very visible volume reduction, and therefore we can lose up to 2 sizes of clothes after a full treatment. This is another picture of the patient himself from the side. And this is how we can see actually the belly reduction and the waistline reduction. Sorry for the slide error. This is a patient B, also 65 years old in Japan, where we can also see a 7 centimeters waistline reduction with a 2000 milliliter volume reduction after a full treatment. This is how we were able to measure the volume loss with the scanner imaging. And this is how we can see actually the results. And we could see in the after 12 sessions, all the fat which are in yellow are much less in the after picture. The visceral fat was almost minus 20 square centimeters less. Another female, 48 years old in Japan, also who lost after a full treatment around 6.1 centimeter in the waistline. And these are the images where we can see how the volume was lost. And this is her last scanning after her full treatment. Another patient in Japan, 46 years old. We can see how it's amazing in terms of abdominal fat reduction. These are patients with this belly that are at a high cardiovascular risk, and this is why the BodySculptor is also considered as a health improving machine, because we do have a cardiovascular risk management along with the aesthetic purposes. Another side profile picture, we can see how slim he looks. Here we have an amazing volume loss, around 3,500 milliliter from the abdomen. This is another patient also from Japan, where we can see not only the weight loss and the inch loss, but also a skin improvement. And actually the tummy looks much tighter and much firmer and thinner. Another patient from Dubai, this one has slimmed really, really well. After 45 minutes session 12 times, we do have an 8.2 centimeter of loss of the waistline, which is around 2 size clothes. We can really see this is a life-changing treatment. This is from the side. We can see like she's a totally different person after her treatment. Of course, we always advise to drink lots of water during the whole protocol, because this can also help losing more fluids and also for toxin elimination. Now, what about the subcutaneous fat reduction? It's actually much easier to measure than the visceral fat. All we need is a measuring tape, and actually results are really amazing all over the body, on the arms, the waist, the hips, thighs, the knees, and the calves, because the suit of the BodySculptor actually covers the whole body, and we do also have a specific one for the double chin. We're gonna see a result later on. This is how we can see that the sub-Q fat has been reduced. We can see the flanks of this lady became way more defined after a full treatment. This is another shot. And this is from the side. We can see more definition. We can see a much thinner figure. Actually also on the thighs and on the waist. Even the tummy looks firmer with less orange peel aspect. We can see that we also have a skin quality improvement after the sessions, and we're gonna see after why. This is another guy from Norway, where we can see he almost lost 2 sizes of clothes. Body looks firmer, less tummy, and also less cardiovascular risk and a better health profile. Another lady after 12 sessions. And this is also another interesting case where we can see the thighs look firmer and the tummy actually looks smaller and tighter. This is from the side as well. We can see the back, the retroperitoneal fat that got very, very visibly reduced. And no person that got the treatment without any serious restriction in terms of calorie intake. They had to follow some rules, of course. We're going to see the protocol later on, but there was no strict diet. So we could tell that this is only due to the machine itself. This is another guy who wore the suit for the upper neck. We can see the double chin reduction. He has a much higher definition of the lower face. And this is after 12 sessions. We could see that he almost lost all the fat layers under the skin in the upper neck area. He became way more defined, and we can see definitely that he looks much sharper and much thinner. Now, what about the skin firmness? As you must all know, losing water and sub-Q fat leads to a better skin aspect. Skin quality improvement is clearly visible after achieving a full 12 sessions protocol. Like in this picture, we can see much less orange peel aspect. The skin looks less wavy. It looks more toned and more firm. And we can see in many other pictures as well that the BodySculptor itself actually leads to some collagen boosting production, which makes the skin look tighter and firmer. As you can see, also all the orange peel aspect on the tummy area has been removed, and these are results we can actually see after 6 sessions. And people with an advanced degree of cellulite can see a total removal after 12 sessions. It's an amazing treatment also for a total body drainage and for cellulite. This is a lady who tried it also on her neck, using also the Osmosculpt anti-aging serum right under the suit. And after 12 sessions, we could see that we've got a nice collagen production and a much better skin aspect. What about the latest studies? Now there's a new study that was updated in 2020 that actually was based on how to measure energy expenditure and substrate oxidation after a full biostimology session. What we did was a study undergone in the Netherlands. Subjects had an overnight fasting, and after that, we were able to measure their basal metabolic rate. After a 5 to 10 minutes break, they had a light meal. And then the subjects were treated with biostimology device for 45 minutes. And then we measured again their resting energy expenditure. And what happened after this study? The natural metabolism is usually, as a carbohydrate oxidation is 60%, and for the fat it's 33%. And with biostimology, the fat oxidation went up to 45%. So biostimology is switching the way of energy consumption. Carbohydrate oxidation decreased and fat oxidation increased by almost 30% with the duration of the treatment. And this is how we can prove once again that fat is being burned after a biostimology session. Now, what about the device itself and the protocol? As you can see here in the picture, it's a very nice suit. The apparatus is very ergonomic, not space consuming. And the suit is really, really very pleasant to wear. We actually wear, of course, hygiene goggles right under it for the treatment to be hygienic for all your patients. And as we can see, once we wear it, we do have a dual action of the machine itself. First, we do have the destocking of fat, which is the main action, which is based on the bioenergetic field. And the additional action is due to the micropressure that goes all the way from the waist all the way down to the toes. And that leads to a very pleasant massage, draining massage, and toxin elimination. And this is also what actually leads to that skin quality improvement after the full treatment. The best protocol is to have a light meal or snack 1 or 2 hours before and after the biostimology session, which is between 30 and 45 minutes, stay for 4 hours with no carbohydrates. Why? Because we need the device to work on the sugar that are stocked already in our body. So if we have an additional sugar after the session, it would be practically useless. The treatment would have been practically useless. After that, have a healthy and balanced diet for the rest of the day. If the patient cannot attend 3 sessions per week, you can offer them 2 sessions, 60 minutes each, but this is the minimum to have this fat oxidation increase and to have a significant inch loss. Combining strategy, of course, we can always try to combine the BodySculptor with other technologies for fat reduction to have optimal results. However, regarding the visceral fat, I do always rely on the BodySculptor when I have someone with high abdominal fat. Within the cardiovascular risk, the BodySculptor is always on top of the line when it comes to treating the patient, combining with radiofrequency or with ultrasounds, or even with some electrostimulating devices can definitely help, because there's always a combination to offer the best for our patients. However, I can actually confess that the BodySculptor is always, most of the times, a part of my patient's weight loss journey. So thank you very much for listening. I hope you enjoyed the webinar. I hope I'll be waiting for your questions right away. And also I'll be wishing for you to stay safe during all this pandemic and hoping this will be over very soon. Thank you very much.
Thank you, Dr. Hani. It was a very interesting webinar. Actually, please ask your questions. We have now some questions. So Dr. Hani, first question that I have for you is actually, can you describe a little bit more the combinations that you do with BodySculptor and other devices or technologies?
Yes, of course. Actually, the BodySculptor is one of the main apparatus I rely on when it comes to weight loss and fat reduction. However, one of the best combinations I've experienced were with the radio frequency and with the ultrasound mainly, because this leads to destock localized and stubborn fat areas, where the BodySculptor actually gives me a total slimming experience. So when I want to target specific stubborn fat, I can go for the ultrasounds, and also combining to some electrical stimulation for the muscles can help me more in the drainage and can help me also to contour and to firm up muscles as well. So these combinations are, for me, what works the most when it comes to a total slimming experience. However, when it comes to health improvement, the BodySculptor remains my first choice.
Mhm, mhm. Thank you. And in the same subject, so do you recommend 2 or 3 sessions per week in your clinics?
Usually we do 3 sessions. However, some people when they're visiting from abroad and they can't stay for a total of 4 or 6 weeks in town, we usually tend to do some express cure, which is like every day. This gives less results, however, but it's still very significant. So sometimes I tend to do them 1 session every day. However, the minimum to me is 3 sessions a week, 45 minutes each. But as I said in the presentation, doing 1 hour twice can also be useful, especially for people who do have some schedule conflict.
Thank you. I have a question from one
Yeah,
doctor.
yeah,
She's saying that actually she has BodySculptor and she's thinking to buy another device based on pulsed magnetic field, so for the muscle toning, and
yeah.
she's asking like which one to do first, the BodySculptor or the pulsed magnetic field. So which device she can use before the other?
Oh, you mean in the same visit? Which one she
Yeah,
uses before?
in the
I
same
always, I
visit.
always, I always use the body sculptor at the end because the draining action that has the body sculptor can help if we've had some destocking of fat with the previous technology. It will help to eliminating much faster when using the body sculptor. So if I have two treatments in one visit, I tend to keep the body sculptor at the end.
Thank you. Other question. Actually, doctor, how do you see? So it's a question. I don't think it's related only to us, but this question: how do you see the future of aesthetic medicine after this coronavirus period?
Okay, well, I see. I think it's gonna pick up very slowly at the beginning, but thankfully, human beings tend to forget, and hopefully they'll be back at their normal lifestyle after that. However, I know that many countries, including Lebanon, which is my hometown, have suffered from a big economic crisis. So businesses might be affected, but not only aesthetic medicine. I'm talking globally about all businesses. However, aesthetics remain essential for lots of people. So hoping this will pick up after the pandemic is over.
Thank you, thank you. Other question. Now, yeah, 1 second. Yeah. So now you are using Body Sculptor with the ultrasound and radio frequency. So do you use more Body Sculptor with men or do you use it more with women?
Actually, at the beginning, we've struggled a bit to convince men to have the body sculptor treatment because the way you wear the suit looks a bit feminine to them. So it was a bit confusing at the beginning. But then
Mhm.
after that, when we've explained the real impact and the real benefit when it comes to abdominal fat reduction and to cardiovascular risk management, especially in overweight people, we were starting to have more men having the body sculptor and enjoying it. And especially that the session, even if it's a 45-minute session, they can still have their work done. They have it's a hands-free device, so they're alone in their room. They can keep on working, having their calls, doing some video calls, etc. Which was actually not that bad to them. Whereas in other technologies, they can't do anything. They just have to wait for the session to be over. So it was an advantage for some of these people, but men were harder to convince than women at the beginning. Now we're almost having equally men and women having the body sculptor treatment.
Okay, thank you. Other question, what's the average of the results that you have? In my clinic, some people are getting amazing results, other
Yeah,
not. I want to
yeah.
understand with your experience why.
Okay, I'm gonna be very clear and very honest. I've been using the body sculptor for about 11 years today, and this is the fourth generation I've bought recently from Cosmosoft. I've started with the first generation. Now I'm at my fourth, and I can tell that in terms of statistic, we can promise for up to 89% of our patients that they will see results We do have a bit of resistance, however, but we can't see zero result in people unless they were going extremely high in calories and not respecting any food hygiene or anything regarding the protocol of the treatment. However, for people who kept the same lifestyle during the treatment, they would have definitely seen results. Of course, they do vary. However, the average is between 4 to 8 centimeters when it comes to inch loss. And when it comes to a fat reduction, we can go up to 5 to 6% in terms of fat percentage after we've done the body analysis at the last session.
Thank you. Other question. So you're talking about the protocol. So
Yep.
Cosmosoft are presenting a protocol where we need to avoid carbs for 4 hours. Did
Yes.
you work on your own protocol, doctor?
It was actually the same protocol I've used. Because the dietitians that work on all the slimming bodies in our practice do also follow the same protocol, and was also always about reducing the carbohydrates, especially the day of the session, because this is where we're going to have the maximum of the technology results.
Thank you. Other question again. So how BodySculptor can improve the health for diabetes and cardiovascular disease patients?
Yeah, well, as I said, it's all related to the metabolic syndrome. When we have a reduction in the abdominal fat, which is the visceral fat, all the others components actually improve by themselves, and including the insulin resistance. When we have a decrease in the fat, especially the abdominal fat, all the other viscera would function better, and therefore they could improve associated pathologies like diabetes, like insulin resistance, even anything related to cardiovascular risk.
Thank you. Another question. So any contraindications that you have seen in your practice as you are using it since 11 years?
Yeah, well, there are very few, but I would avoid it, of course, like any other technology for people holding a pacemaker, people that have a very capillary fragility in their capillaries. I would avoid this, and people with phlebitis, and that's it. Honestly, these are the contraindications where I'm very strict, where there's no way they could do the treatment.
Doctor, you talked about to use it every day. When you use it every day, you do also 12 sessions, more or less? 12.
Yes, we do. We do it over 2 weeks, from Monday to Saturday for 2 weeks. We do have very nice results. However, I'm pretty sure if the same patient would have done it over 4 weeks, she would have lost more, because you always give the body more time to respond to the technology.
Thank you. And same topic. So regarding the protocol, so you are talking about a daily or 3 sessions per week.
Yeah.
We can do less. So less sessions per week, less than 3.
Two would be a minimum. I'd say if people have a schedule conflict, I would go for 2 sessions a week. However, session would be a bit longer. I'd go for 60 minutes.
Okay. We have another question. So for BodySculptor and Redustim, I assisted both of the webinars. What's the main difference? So
the main difference between Redustim and BodySculptor is actually the target, because actually it's almost the same technology. However, that we target BodySculptor more for beauty centers, for aesthetic purposes. However, the Redustim has followed much more clinical trials and is more medical-based device. However, in terms of technology, they're both based on the same technology, but I would recommend the Redustim for people with serious pathologies, because they'll be followed by doctors. However, the BodySculptor would be more in spas and beauty salons for just to improve the figures and for only getting aesthetic results.
Thank you. Doctor, so now you are a user of BodySculptor. Are you recommending it for kids and patients under the age of maturity? That's the question that we have. So if you recommend
Maturity
it
meaning,
for...
we started starting 16 years old, age of 16, we can start.
So you start at 16, okay.
Yes.
Okay. Another question. So we will still keep the webinar for more questions if you have.
Yeah, sure, sure.
Yeah, I hope you still have time.
Yeah, we do have time, no problem. Take your time.
Thank you. But it's very interesting because we believe also now patients, they will avoid a little bit like the surgeries. They after this crisis.
It's an excellent alternative for surgery, definitely. At least we have no downtime. We don't have any downside also of the surgery. The BodySculptor is a machine we can keep on doing all year long, and we can repeat the sessions as much as we want. I've had people having 2 or 3 treatments in a row because they needed lots of weight loss, and this has allowed them to actually avoid having liposuction or any other type of surgery. Even we've spared lots of people bariatric surgery thanks to the biostimology. So yes, definitely the trend is more into non-invasive, into stuff that need no downtime. People don't have time to lose waiting for themselves to recover when they have a better option and a faster one.
So you target also like obese with BodySculptor, and you do like many treatments, like more than 12 sessions to help them to treat their obesity, right?
Yeah, we can do more than 12 sessions. Of course, I've done for people 2 or 3 cures along with a good diet and some improvement in the life hygiene. And this is much better than having a liposuction, because if we gain weight after liposuction, results can sometimes be catastrophic.
Mm-hmm. Mm-hmm. I think we got all the questions. We don't have more questions for now. I hope that you enjoyed our webinar. Dr. Hani here, he is sharing with you all his social media and website. So if you have any question, any other information that you need from him, then BodySculptor, so his user for other technologies. So I think he will be here to give you his insights. Again, stay safe, and we hope to receive you for other biostimology webinars. Dr. Hani, any word that you want to share with our audience?
I just want to thank them all for being there and for listening, and thank you all for your questions. I hope it was a useful webinar, and do not hesitate to contact me on any of my social media platform, whether you need any advice regarding your treatments in your practice, and also stay safe. Thank you.
Thank you. Thank you, Doctor. So we will end this webinar as we got all the questions.